This episode is sponsored by Welbeck, providing beyond better healthcare.
Hello, everybody. Welcome to Self-Care Club. I'm Nicole Goodman.
And I'm Lauren Mishkon. Today, we are joined by Dr Lorenzo Masci, a sports and exercise medicine physician based at Welbeck Orthopaedics. Sports and exercise medicine physicians take a holistic approach to diagnosing and managing any musculoskeletal condition or medical problem associated with physical activity, irrespective of age or ability, by providing a range of conservative treatment options to get you back to your normal activities. After medical school, Lorenzo quickly established himself in the sports medicine community, working in the British military, private practice and elite sporting organisations such as Fulham Football Club and Wasps Rugby, and as a consultant for Melbourne Storm Rugby League, Tennis Australia and the Victorian Weightlifting and Judo Associations. He has a specialist interest in managing tendon disorders.
Lorenzo, welcome to Self-Care Club.
Thank you for having me.
Thanks for being
exciting.
here. Yeah, it is exciting. I'm really excited to have you. I'm like going to just pick your brain to pieces.
Please.
Now,
please.
Can we start? Let's start at the beginning. What is the
Yes.
difference between soreness, just a bit of muscle soreness, and actual injury? How do you know the difference?
That's a really good question, actually, because at the beginning, it might not be that obvious. So people can, do an activity and get a little bit of muscle soreness or a bit of soreness somewhere and think, oh, this is just part of, recovery as we do get soreness. But I think if it persists and it doesn't go away after, a couple of days of resting, recovering, we might talk about a bit about recovery, then, it could be an injury. And I think generally with injuries, I always say it's probably best to get them checked early. And it might be a case of just seeing, a therapist that you like to check it. And then if there's a bigger issue, then you might want to see someone like myself, who can assess and decide, A, is it an injury? B, how severe it is, what you need, what treatments you need, and so forth. So it can be difficult in the beginning.
So after a few days, if it hasn't gone away, it's probably better to see a physio, an osteopath?
I think most conditions, a good physio that you trust or good osteopath you trust. I think it'd be good to touch base with them and say, I've got a sore shoulder, I've got a sore back. What do I need to do? What is it? What do I need to do to make it better? I must say most musculoskeletal conditions are pretty mild and will get better with a little bit of correct self-management strategies. But so I think someone you trust would be good.
Okay.
Yeah.
Thank you.
What about hormones and injury? Because when you're in your 40s, I think it's true to say everything suddenly hurts more than it used to. Do hormones affect tendons and joints? Do you see that?
Absolutely, yeah. I see it a lot actually in my practice because I have an interest in tendon disease and people who have tendon pain. So you see this spike. So there's two spikes. There's one, when you're younger, and then you see this spike at middle age starting about 40 to 50, and you see this increase in people who have tendon and joint problems. And particularly in women, we see, if you have a tendon injury perimenopausal age, it does take longer to get better. And we think part of that reason is because of hormonal changes. So you get a drop in estrogen and progesterone. And we know that estrogen particularly is an important component of tendon healing.
Oh.
And so I think, yes, the answer is yes. And I think, and even in men, actually, we see it, as we get older, as men get older, that testosterone levels drop a little bit. And again, we tend to see not necessarily an increased risk, but certainly if you do get an injury, then it's more likely to last longer. And part of that reason is not only aging, but hormonal changes. So I always get asked the question, what does that mean if I take hormone replacement therapy, it'll make my joints and tendons better? So we don't know the answer to that. That's a little bit controversial. I always say to people, if you need to take hormone replacement therapy for something else, usually it's symptoms. So women, it tends to be symptoms generally. Then it's a good fringe benefit, I think. It's an extra that perhaps, another benefit is, at least neutral or positive effect on musculoskeletal structures, tendon structures, joint structures. So I don't sort of recommend at the moment taking supplements or taking hormone replacement therapy for a particular condition.
Mm-hmm.
But I think if you're going to be using it for other problems, usually symptoms, then I think it's at least neutral, if not positive.
Okay, that's good to know.
Now that you've mentioned supplements, can we just talk about that a little bit? Because it's a world, it's just gargantua and it is never ending.
Huge.
And
I don't know how many billions in the world.
my
Billions and
algorithm, billions, and my algorithm and your algorithm, they like to serve us every single supplement that's just coming onto the market.
Yeah.
Are there any that you work with that you really like for sports recovery? Are they all a load of rubbish? Like, what is your thoughts on supplements and any in particular that you think are great?
So I, as a general rule, don't recommend supplementation for recovery as per se. I think there are certain supplements that may have a benefit in certain diseases that I see, osteoarthritis being arthritis of joints. There's a couple of supplements that have some evidence for them, albeit quite tenuous. So it's not definitive. It's not like a drug. But I think there are some supplements that I recommend for osteoarthritis. There's maybe a little bit of evidence for tendonitis, collagen supplementation, perhaps maybe collagen, but I certainly, as a general rule, I don't recommend it as a treatment option, unless people are really keen to take supplements. And if I say, look, I think if you're a supplement taker, then these are the ones that I would recommend. But as a general rule, for disease processes, I'd say no. As far as performance enhancing, there's very few out there that really do anything. I think maybe, for muscle development, maybe creatine a little bit. But really, there's not a lot of evidence for any of the supplements. The big one that I hear, at least once a week is peptides.
What is a peptide?
Peptide is just a simple amino acid, which is a protein. It's just in a slightly... The shape of it is, and the size of it is slightly less than, say, we would have with a protein. So they're just branches of the building blocks of protein, which are amino acids, but slightly smaller size. And people are now, taking peptides to enhance performance and muscle mass and tendon recovery and injury recovery. And really, there's very little evidence for any of it. And in fact, there might be some evidence that you actually can be harmed potentially harmed by taking it.
Why?
So a lot of the studies have been done on animals.
Okay.
So animal studies, and you give animals supplements, and it shows that yes, they do get an increase in collagen formation or increased tendon strength, but none of them been done on humans. And so a lot of these peptides that have been sold, A, are unregulated. So we don't know exactly know what's in them. B, we don't know the exact effect of them. We know the effect on animals, but not on humans. And there might be also some concerns about, potentially causing things like tumors. If you produce these, you increase the amount of peptides that you're injecting peptides, that it might actually have, a deleterious effect on certain pathways in your body that can actually produce, cancers and tumors potentially. So it's quite worrying. So from a peptide perspective, I always say to people, just be careful. I think I'm not sure I would strongly recommend taking peptides.
Every year there's like an Emperor's New Clothes.
There is, isn't there?
Some form.
This year it's
everyone goes mad
peptides.
for it,
Last year it was something else.
Last year was NAD.
That was 2 years ago.
Year
NAD.
before,
NAD.
collagen was a whole big thing. And
Then it was CBD before that. That seemed to help anything and everything. I mean, I
Yeah.
quite like CBD, but, just as a, I don't know, it helps with anxiety a little bit. It would be like, if you're an insomniac, take CBD. If you're a migraine sufferer, take CBD. If you've got
If you're having a nervous breakdown, take
Yeah,
CBD.
yeah,
It'll
yeah.
fix
Yeah,
everything.
If you've got a bad back, take CBD. I
If you've
remember
got a bad
someone.
relationship, take CBD,
Yeah.
that sort of stuff. Yeah.
Yeah.
Well, I think peptides is the new
CBD,
one.
yeah.
Yeah. It cures everything apparently, and
Okay.
but I sort of, and it's actually also banned in sport. So if you
Oh, it is.
Yeah. If you're an athlete and you get caught taking peptides, you could be sanctioned.
Wow.
Yeah. It's banned
Okay.
in sport. So certainly the group that covers sport, they're called WADA. They've actually banned peptides, and part of the reason is because there's no evidence
Yep.
for it, and B, it's unregulated, and so you could be taking something that potentially is harmful, and whether it's performance enhancing or not is questionable as well. So I would stay away. And as a general rule with supplements, I think, I mean, it's cliche, isn't it? Good healthy diet, lots of sleep, some exercise. Don't go overboard with exercise. That's probably all you need. I mean, in most cases.
That sounds great.
I
That sounds perfect for me.
yeah. So just moderation.
Okay.
Probably worth not smoking, not drinking too much. The usual.
Yeah.
usual
Moderation.
cliches.
Everything
Yeah,
in moderation.
But whatever doctor we have in here from Welbeck, whatever department they are, whether they're coming from cardiology, whether they're coming from your field, I mean, all over, all gynecology, all across the board, everybody says the same thing. It's lifestyle. You have to eat well, you have to sleep, you have to hydrate, stay as calm as you possibly can.
And have friends.
Be sociable. Like, just have a nice balance in life and look after yourself.
Mm-hmm. Absolutely.
Do you think walking is underrated as an exercise?
I think walking is a good exercise. I think it is probably underrated because people think that they're not getting enough of a workout. But certainly there might be slightly better exercises than walking. But
Please don't say it's running.
Sorry?
Please don't say it's running.
I mean, I think it depends on the person. I mean, I think it's probably good to get your heart rate up, and you can get that with walking. You need to get the heart rate up so that you get that bit of heart fitness as well. But certainly running is not necessarily something that I tell people to do. I think there are certainly other types of exercise that you can do. I think the important thing with exercise, and obviously a sports and exercise medicine specialist, so I want people to exercise, but I see this a lot in patients that I see day to day, is that as we get older, we don't really regulate our exercise that well. So we treat ourselves like we're 20 when we're really 40 or 45 or 50. And I think then you get injured. And I think the important thing is that you just need to ensure that, you don't do too much of anything, one particular exercise. So I like a varied approach to exercise. So you're doing a little bit of aerobic conditioning, you do a little bit of weight training. You might want to do a bit of yoga, a bit of paddle. It's varied. And it's not just lifting weights or doing one particular exercise that is in one direction only. It's good as we get older to train ourselves to move in different directions. Balance is really important. We know that. So I think walking is good, but I think doing other things as well is also, I think, quite beneficial.
Do you think that women are overdoing like the HIIT and the intense stuff, midlife women, I mean? And what do you think is the best form of exercise for women in midlife?
I think so. The issue that I see a lot when people get injured, they come and see me, and the biggest error they make is they often do something new. It's usually HIIT or boot camp.
We know the one you mean. It's okay.
Boot camp.
Yeah.
They join it, and then they suddenly go from nothing to like 5 times a week, and then they get injured. They're like, why did I get injured? It's like, well, you're doing too much of that high intensity training, and this is the point about as you get older, you need to moderate and make sure that you don't do too much high intensity. And this is where walking might be actually quite useful, in that as a way of cross training, as a way of changing up your activity. So I think if someone said to me, middle-aged female coming in saying, I want to exercise, what should I do? I would say variety is the spice of life. Do some low impact, some high impact, a little bit of weight training, but vary it. And don't do too much of anything, specifically high intensity training. Because high intensity training, it has puts a lot of load on your body, and then as you get older, as you get into the middle age, it takes a lot longer to recover. So, a little bit of variety day to day in what you do, and I think the key is to remain injury free. If you remain injury free, then you do very well. Moving forwards as getting older. So it's remaining injury free. That's the key. Because I see people that get injured, and then they get injured for like 6 months or a year, and then their conditioning just drops. And so they want to do Barry's or they want to do HIIT training, and they're thinking, oh, I'll get into fitness, lose some weight, but then get injured for 6 months. Well, what's the point? Why don't you just?
And then they go back to it. I mean, that is like that is ridiculous to me.
I can see the attraction though.
No, I can
see. It's a very addictive. It's addictive. It's competitive.
Yep.
You've got it's social.
Yep.
People find partners there, and because everyone in that like frame. So I can see how addictive it is, but I agree. That's an issue going back to it. But hopefully you learn from that. You learn from it.
I mean, I have had to adapt my training so much over the last 5 years, just because I got because of injury, because I just couldn't do that plyometric stuff. I just couldn't work at that rate anymore. And now when I look back to it, I mean, I just think, what was I doing? I was being
you were very addicted to it, and you got
completely
it was
addicted.
like your real thing to go and chuck stuff around and chuck yourself around, and then you couldn't anymore. So now you don't. And look, what great shape you're in.
Excellent. See, and it's about moderating and learning.
Yeah,
learning and moderating. I think that's the biggest challenge people have as they get older, is particularly if you're keen on getting healthy and fit. It's pulling back a little bit and saying, I think my body's had enough this week, and I need to have a light week this week.
Yeah.
It's very hard to do when you get on that train of getting fit, losing weight, feeling good, looking great, people commenting about how great you look. Pulling back is not such a thing that a lot of people do, and I think that's the biggest error that you make, that I see people make.
But they do it too much.
Too much of usually the high intensity exercise. So what's high intensity? Running, HIIT training, jumping, anything that involves jumping, running, those sort of things. Even paddle. I think you need to be aware that you don't want to sort of do that every single day, and just to give your body a bit of a break,
my God, yes,
a bit of a rest, particularly if it's higher level, competitive paddle.
Well,
intermediate level.
Yeah.
No, but I noticed, because I do play paddle a lot and I weight train a lot. And for 6 weeks, for 8 weeks, I wasn't in the gym at all. I couldn't. I had surgery, so I couldn't be in the gym. And then I went back to paddle, and I noticed after a few weeks of playing, like most days, without the conditioning, without the weight training, my body was wrecked. So I had to pull right back from paddle, wait till I could rehab in the gym, and now I found my balance again. But I've learned the really hard way how to listen to my body. So if my body is twinging, if my body is in pain, then it's telling me something.
Exactly.
Right?
Exactly. So that's a little early warning sign that you're overloading. And I think particularly for injuries like tendon injuries, they take a long time to get better.
Oh my God, that's
like
so
months
boring.
And months, and it's boring. So best thing to do is prevent. And the way you prevent that is the most important thing you can do is moderate your high intensity training. And that is, the running and jumping and even fast walking, that would be classified as a higher intensity session. Not as much as running, but certainly higher. So that would be my suggestion if you're going to really get into fitness, is just do it very gradually.
Do you see a common injury in midlife women in your clinic?
I see tendon injuries.
Oh, really?
Yeah,
Yeah.
really common, like particularly hip tendons.
Oh,
Yeah, hip tendons, hamstring tendons, higher up in the pelvis. So they're the really common ones, and they're notoriously difficult to get better.
oh,
And women can struggle and struggle and struggle, and because of we were speaking about menopause before, because of menopause and hormonal changes, it can make it even more slow and difficult. And so prevention is better than the cure.
yes, yes, yes.
So I think preventing is always the best way to do it. And so how do you prevent that? We talked about load modification, keeping your weight under control. That's really important. And a lot of people don't realize, this is another thing that I have to explain to people, is that when you put on weight, particularly fat, adipose tissue, it's very inflammatory. Adipose tissue is very inflammatory, particularly around here. A lot of men get it around their abdominal area, not so much in women, but in men. And that is really inflammatory. So anywhere where you have the start of inflammation, like in knee or tendons, that fat will produce substances that will then travel to that area and cause more inflammation and more pain. So actually,
clever.
keeping your weight under control and keeping particularly fat percentage, not necessarily muscle, because we know that muscle's heavier than fat. So it might be that you are heavier than normal, but it might be muscle, and that's okay. It's the adipose tissue or fat that's really inflammatory. So losing or maintaining a good weight as far as fat percentage also is really important to keep your bones and tendons and joints healthy. So I tend to reinforce that. It's not just the weight per se. People think, oh, well, if I lose weight, then there'll be less weight on my body. But actually, yes. But actually, what's more important is inflammation in your whole body, and reducing that by reducing fat percentage. So fat is really something that we I think we need to have a little bit of fat, but I think having excess fat and being obese is
It's problematic.
I think a lot of things can be helped by just maintaining a good weight.
Can we talk about recovery a bit? What do you think is the most underrated recovery tool? The thing that kind of people ignore but is really obvious and easy?
I think most obvious is sleep.
Sleep.
What a lovely answer.
Do you think that if you're getting poor sleep, that can in itself cause injury and slow recovery down?
Yeah. So I think getting a good sleep, and obviously everyone's different about how many hours they need, but I think sleep deprivation is epidemic in society. We're on our phones all the time, and everything's go, and I think rest and sleep. So I think that's the most underrated. So people talk about, taking supplements and having ice baths and, massage, and they all sort of help to some degree. But if there's one thing that can really help your recovery and also prevent injury, is getting enough nap time.
Back to basics, right?
It's all back to basics. This is what I love. How much is enough sleep?
I mean, I think if you look at some of the studies, you need to be getting 6.5, 7 at least. But it's also good sleep. Yeah, so good sleep is really important. So you need both what we call deep sleep and REM sleep. So they're both different, and I think you need a bit of both. And deep sleep you get at the start of sleep, and then the REM sleep happens, which is the dreaming sleep that happens towards the end. So you need a bit of both, and I think getting 3 or 4 hours of sleep a night is probably not enough.
Oh God, no.
And I think we need look at the studies, 7 to 8. I mean, most people probably don't get that, I must say.
Do you sleep for 8 hours?
I don't. I wish I did, but my body clock is such that in summer I'm up with the birds.
Oh,
5:30.
Okay.
Yeah, I find it really difficult. So I have to go to bed a little bit earlier, but I get a bit more sleep deprived in summer. I don't know. My body clock is such that I'm up early, so I have to compensate for that a little bit. And perhaps during the week I get a little bit less because of work and family issues.
Yeah. And how do you know if you're getting good quality sleep?
It's a good question. It's hard. It's hard to know that. But I think there are sleep studies where you can if people are not getting enough sleep, you can actually do some studies to see exactly how much deep sleep and REM sleep you do. It's difficult to know. I'm not sure the gadgets we have today.
I was about to ask, the trackers and all. No,
I'm not entirely convinced that they'd track good sleep quality. I think the basics are that you shouldn't be waking frequently, because if you wake frequently, then you disrupt that balance between deep sleep and REM sleep. So you shouldn't be waking frequently or getting up, frequently, going to the toilet. And I think if you can get a good, decent chunk where you're not up and about, then I think there's a good chance you'll be getting enough of that, of those two different types of sleep, deep sleep and REM sleep.
Disrupted sleep, you might go to bed early and have a full night's sleep, but if it is disrupted in the night, you feel terrible the next morning.
Yeah.
Like when you're up with the baby, or the dog barks, or the alarm goes off, or whatever it is, and you're up in the middle of the night, you never feel okay the next day. No. What about stress? Why does that affect the body physically so much?
I mean, I think stress is, again, underrated. But I think what stress does is it increases this hormone called cortisol.
Can we talk about cortisol? Because my algorithm's obsessed with cortisol.
Is it?
Yeah, I don't know why. I feel fine, but
Yeah.
it loves to tell me about it.
Well, cortisol is a fight or flight hormone. So you produce it when your body is under some sort of pressure. And that can be a number of different things. It could be that you're running away from someone who's chasing you, and then your cortisol levels go up.
Very unlikely. Also, probably wouldn't be able to run away from someone who's chasing me. So who's going to be
or it could just be you're under pressure at work, and you've got a deadline and to meet, and cortisol levels go up. So it's great for getting you out of difficult situations, like being chased. But not so good because what happens is then that leads to this increase in sympathetic response, which is this autonomic system, and then that leads to increased heart rate and production of other hormones as a result of that, which probably is a little bit more detrimental to your body if that's stimulated consistently over time. And I think as far as recovery is concerned, it will then reduce the recovery. Your body's ability to recover, regenerate. So cortisol has a role, a very important role, but if it's overstimulated consistently, then I think it has potentially detrimental effects on your body. Okay. And from a recovery perspective, I think it certainly reduces the time, or increases the time to recovery or healing of injuries.
Don't most people have like really high cortisol then? Because so many people are walking around stressed out, sleep deprived.
Yeah. I mean, I think that's part of modern society.
Yeah.
And I think, we just sort of get used to probably running on really high cortisol levels. And that, I think, then has potentially some harmful effects on our bodies.
Yeah.
In general. High blood pressure.
Oh my God. Yeah.
Yeah. So I think
it all has a knock-on effect, doesn't it? Because then you're stressed, so you don't sleep well, and then you're tired, so you eat badly, and then you're stressed, so you can't eat, and then
then you're too tired, you can't build to exercise. It's just
exactly. Exactly.
It snowballs, this stuff.
Then you start smoking, then you start drinking, then you feel crap.
Then you start watching Homes Under the Hammer at 3 p.m. And then it all goes to pot. That's it.
Then you have to start Couch to 5K.
That's right.
I want to talk a bit about expensive recovery trends. Do you think they're worth it? What do you think about cold plunges? What do you think about infrared saunas? Debunk this for us.
Look, I see so many people that do these sort of recovery strategies, and I'm not sure really, apart from the fact that it might make you feel a little bit good for a little while. I just don't think they're really worth it. I mean, cold plunges, yes, there is some evidence that it might improve recovery in the short term. You get sort of this cooling effect, which reduces swelling. So if you had a big workout, yeah, you could. But as far as doing it to improve overall health, I'm not sure there's any evidence for that at all. Infrared, definitely not.
No? Oh, really?
Not into it? No.
No, I don't.
Oh, I'm so upset.
Are you? Really?
Yeah.
You like it?
Well, I just like the idea of it. I do. And
I've never actually done it.
Yes, you have.
I haven't.
The other
Yes,
one's
you have.
hyperbaric oxygen. That's another one.
Oh, we did that.
Yeah.
It was
did
like
you?
being
How was
in
that?
it was like being in a spaceship. It
Oh,
was
that was
weird.
quite- that
We
was-
were in like this basement.
That was a very weird day.
It was a really weird day. We were in this like
hyperbaric
basement
oxygen.
spot. Oh, it was weird. I just had needles in my face. It was a whole. I'd had like a
we asked to get out.
micro rolling, whatever they did on me.
Oh, really?
Microblading.
The micro.
Then she
needling.
said no, but she said, "Oh, it takes a while for it to." What was it? The word?
Decompress. For
Yes.
the chamber to decompress. We'd had this weird day, and then we were locked in this spaceship, and then I just got the giggles because the whole thing was so weird.
And then I was just like, "Just get
We
me
gotta
out
go,
of
I wanna
here.
go, I
Just
wanna
get
go."
me out of it because you've got to wait for it to decompress. Just open the door. It was awful.
Yeah, I mean, if you're claustrophobic, that's a problem.
I'm not.
No,
I
no,
wasn't
it
that.
was just a
Yeah.
weird day.
Yeah,
thing.
no, hyperbaric definitely not. I mean,
Infrared. Back to infrared saunas. They're no good.
I mean, are they? I'm not sure if they're no good, but I don't know if they're really going to help you. I mean, I think I'm all for if people want massages to relax. I mean that's fine. Having a sauna if they feel
a
like
normal sauna's good.
I think
Sweat it out.
I mean, I think it probably has a role in relaxation. Potentially makes you feel good. During winter, it probably makes your body feel good. But as far as enhancing recovery, I don't think there's any evidence that it does that. And I think if it makes you feel good and it's not harmful and not too expensive, I don't see a problem with it.
Okay.
But it wouldn't, like an infrared sauna and a cold plunge, they wouldn't necessarily help with an injury, like a
No.
proper, right? So if you've got a bad back, for example.
Look, I'm open to people trying different things if they want to try it and they want to spend money on trying it. But I just say, look, as long as it doesn't harm you, I don't see a problem with you doing this sort of slightly left of field treatment. But I think you've got to get the basics right too. That's the issue that people don't get.
Yeah.
So they do all these sort of expensive treatments,
Yeah.
but they don't sleep enough. They don't eat well.
Yep.
They don't do their rehab exercises.
Yeah.
They just rely on these sort of, expensive. I
Gadgets.
call it the extras. So if you don't, it's like when you bake a cake. So you bake a cake and you put this really expensive icing on top.
Yeah.
Great.
Yeah.
But if the cake itself doesn't taste good, then it doesn't matter what the
Yeah,
icing's like.
yeah.
And that's the same sort of thing with
Yeah.
a lot of these extras and very expensive.
This is my language, you see.
Yeah. So I think you've got to get the cake right. If you get the cake right,
Yeah.
then yes,
I'm
you
all
can-
about the cake.
Yeah, you can. Then you can look at the expensive icing,
Yes.
and it might add a little bit.
Yes.
But if the cake doesn't taste right, it doesn't matter what the icing's like.
It's so true.
It's like
Listen, I was a hairdresser for 30 years, right? No, I was. And if you do not get the basics right of a haircut, if you do not know how to do the absolute foundation of a haircut, that haircut is going to last 1 week tops. You can put all the fancy feathering and this and the razoring, do what you like, but the hair's going to collapse after a week. It's got to have a foundation. And it's exactly the same as cooking and it's the same as sports recovery. It's like everything.
same. Yeah.
But we said this in our book, right? We called it plaster practices. We were like, you can buy and do and go and do all this stuff and buy all of this stuff and slap it on. But if everything underneath is rotten, like it's not going to work. It will
That's
last
right.
for an hour. Like, it'd be lovely for an hour, but you're still going to have a shit job and an awful relationship and you're feeling unwell and feeling
and
stressed.
sleep deprived.
Right.
Yeah.
So yeah, we agree with all of that.
It is the basics of your lifestyle. And I think a lot of people want to outsource, especially when they're injured. Like they want to outsource that, right? They want someone else to make them better.
The other thing that I see a lot is that people don't want to put in the hard work to try and get better.
Yeah.
They want to rely on injection.
Yeah.
Or they want to rely on these passive treatments. And again, they all have a role. Don't get me wrong.
Yeah.
I mean, I think there is a role in,
Yeah.
but the basics have to be there, which is know what you've got, understand how to get it better as a general rule, apply those principles really well, get your basics right, and then you can add in the extras if you want to try and enhance what you've got. I think that people, have these injections now for arthritis that, they've got a role, but you've got to get the basics right. Lose a bit of weight, exercise a little bit, put on a bit of muscle mass, and then the injections will help more than if you don't do that, don't get the basics right. So
You can't escape it.
you can't.
But also,
Doesn't matter how much money you throw at it.
Yeah.
You can't.
but the beauty of that is you're in charge of that. You have your own agency around that. Like, you can fix this. You can fix this. Nobody else, nothing else, no
Exactly.
product, no supplement,
That's
no
right.
massage, no infrared sauna. You.
That's it. I agree. I see a lot of people outsourcing the responsibility and spending a lot of money in that process. And I think probably not getting the most out of it.
Yeah. I asked my physio this. I said, you must get so frustrated with your patients when they don't do their exercises. She said, well, their injury just goes on and on and on. She said, so now I have to figure out, are they going to do their injury? Are they going to do their rehab or not? If they're not, then she tells them, you'll just keep coming to me every 3 weeks and I can massage it out, but we're not really fixing it. Because people don't want to do it. It's boring. I get it.
And the other thing I see quite a lot, and certainly I call it the TikTok society. Swipe left. People want results immediately,
Yes.
and they lose interest really quickly.
Yeah.
And unfortunately, particularly in my area, which is musculoskeletal, things don't happen quickly, and I think it's really challenging now. I think we've become accustomed to having everything like that.
Yeah. Instant
Straight away.
gratification.
And if it's not there, then I need something. You need to do something. Do something.
Yeah,
Inject me. Take this supplement or
Stick me in a sauna.
stick me in a sauna or do something to make it better. And I think the problem with a lot of those other treatments is it can cause harm as well. So you could, if you have an injection, you could potentially get worse with it, or if you have a surgical procedure, that potentially that could make you worse. So you just got to be careful of that instant gratification, and I see a lot of that. And it's challenging. It's fun too to try and.
I had a frozen shoulder for 18 months and I ended up seeing a shoulder specialist because they thought it might be a rotator cuff. And I was like, what can I do? And he said, it will self-resolve. I said, but what's the best solution? He said, the best solution is nothing. He said, no injection, no manipulation, no physio, nothing. He said, leave it alone. It will self-resolve. And honestly, after 18 minutes, it just disappeared. Really bizarre, very common in midlife. But also, he was completely correct.
Time.
Just patience and time. And let it heal itself. And it did. Really strange, but.
Yeah. And I think our bodies, particularly with musculoskeletal, our bodies will do that. But it needs patience.
It was 18 months of a lot of patience.
And having had lots of injuries myself, I understand how frustrating they are, because you can't do everything you want to do.
Well, I couldn't take on and off my clothes. It was really tricky.
I sort of get it, where your lifestyle is affected, so you can't do the things you want to do. You can't play sport. You can't. That means you can't socialize as much, but it's a time issue. A lot of times I'm setting expectations for people. It's going, okay, this is going to take 6 months, but as long as we see improvements gradually over time, that's the best way to manage this condition, and not have that instant, I want it fixed, have an injection, but give it time. And as long as the things are improving. Now, some people don't follow that path, so they get worse. And in those cases, yes, you would look at some sort of intervention. But as a general rule, I think just letting time play its role in getting things better, and you just managing it. Simple, isn't it? It's really simple.
It's the worst, but I've heard it so many times with all my injuries, and and I'm the most impatient person. So to hear that like years ago is just crushing, utterly crushing. But now it is what it is, and you can't rush it.
No.
And when you try to, you just put yourself back.
Potentially, yeah.
So the quickest way to get better is just to take your time. Really.
Yeah. Slowly but surely rinse the race.
Yeah.
Just over time, things just get better.
Yeah.
I think, the temptation is to intervene.
Yep. What's the best way to get back into exercise if you've stopped or you haven't done it for a long time and you're kind of in midlife and you're like, oh, I need to do something? How should you begin?
Look, I think that's a really good question. I think it just depends on the person.
Okay.
Yeah, and what you like doing. I think pick something you like doing.
Yeah.
Mm-hmm.
And then just find out a little bit about what would be the safest way to do something.
Mm-hmm.
And then, for some people, it's about maybe getting a PT potentially, or exercising with friends, so the important thing, I suppose, is to find something you like and set up a process where you're going to be doing it consistently.
Mm-hmm.
Consistency is the key,
Mm-hmm.
I think. I see so many people who say, right, after January, I'm going to start the gym and I'm going to, take out a 12-month membership, and then they last 2 weeks and they stop. So consistency, I think, is the key. And so find something you like, be consistent, and find ways to maintain that consistency, be it with friends or PT or joining a gym or doing something so that you get into this routine of being consistent. And then I think variety is, we were talking a little bit about variety and having a few things that you can do. I really like, people talk about Pilates and yoga and, what are they good to do? I've got a bad back. My view is it doesn't really matter as long as it's reasonably safe and you like doing it. If you don't like doing it, there's no point in doing Pilates. If you don't like Pilates, and I'm not going to say to you do Pilates just for the sake of doing Pilates, but I think a variety of exercises is good. Like paddle would be great, but if you like doing it, then I think it'd be good to do something like that.
You have to enjoy it.
You've got to enjoy it. Otherwise, there's no point in doing it.
Yeah. Yeah, and there's so many ways to move your body, even if it's go to a dance class, go to a Zumba class. Like, there's so many ways, isn't there?
Yeah.
There's really no excuse to not do it.
Exactly. It could even be, I don't know, something like, a walking group or something.
Yeah.
Where it's social, or just moving and being active, and not being too hung up about, well, what specific benefit do I get from walking or from running or from swimming, but I think it's important just to move.
Yeah.
And be consistent.
Yeah.
Consistency is the key with that. I think once you then start seeing the benefits of it, it's then starts to then be easier to maintain.
Because you want to go.
Yeah, exactly. Exactly.
What is a common misconception you see in the fitness industry? And it's a twofold question. And what is a common misconception you see in the fitness industry around aging as well?
So the biggest misconception that I see is that you have to be lifting, you have to be doing the type of exercises that a 20-year-old does to look good and to keep fit.
Yeah.
That's the biggest misconception that I have. Certainly in the gym that I go to, I see people my age, a bit younger, a bit older, who are doing completely inappropriate exercise. And I feel like going up to them saying, this is my card.
Get that weight off your back.
Yeah. So I think the biggest misconception is that you have to be doing high intensity exercise to look and feel and maintain fitness, appropriate fitness. And I think that's the biggest misconception that I see, and the biggest error that people make, and they come to me because of that.
Interesting.
And I think we were talking a bit about this before, about moderation, and I think when you start exercising, it's important just to really start at a low level and then increase very gradually. And it really is keeping injury free. That's the key. As you move on, keeping injury free, just not getting too hung up about immediate results, and I've got to look like this by summertime, or just being consistent, slowly improving your fitness. I think that's the big. And then people, maybe getting a PT and the PT treating them like a 20-year-old when they're actually 50. That's the error the errors that I see.
Mm. What do you do for your own self-care, Lorenzo?
So I do a bit of gym.
Mm-hmm.
I do a little bit of running, but I've decided that I'm getting too old to do really long distance running. So I do a little bit of running. I do a bit of variety. I do some yoga. Really like yoga for that mental aspect of it as well. And I just do a combination of things. I've got a little program that I do, that I've got a PT that I see every now and again to give me a little program. And that's me done.
Mm-hmm.
So I exercise most days, but I need to take breaks, and so I try and practice what I preach.
Yeah.
Sometimes I
Yeah.
don't succeed, and I do get injured myself.
That must be so frustrating.
Yeah. And I'm a
When you
terrible
do.
patient. I have to have a physiotherapist that guides me, even though I know a lot about the injuries. But I just do a variety of things.
Yeah.
And I find, you get into this situation where you just know your body and you know what it feels right and what doesn't feel right. And I think that just comes with experience.
Yeah. And age.
And age, yeah, exactly, and not being too hung up about needing to work out. Every workout has to be 100%. So just a bit of variety, a bit of just managing, and then trying to the usual things, get enough sleep, and doing some activities that reduce stress. And it's really, really important. What do you guys do?
We do this podcast.
That's not our self-care. That's our job.
I don't believe in self-care.
All right.
I've done it for 7 years, and I'm basically now where I'm back where I started at the beginning, where I do the things I do that I've always done that work for me, and I don't need the extras.
Exactly.
The basics really do work for me. They
They
really
work for
do.
they work for
They work for everyone
everybody.
because they're basic. I get out in nature. I walk my dog. I get enough sleep. I see my friends. I eat well. I feel okay.
And you read and you cook.
I read a lot. I cook a lot. I do Pilates twice a week. Woohoo! That's new. And everything in moderation.
Yeah.
Perfect.
Yeah.
Sounds divine.
Yeah.
She does everything. I do much less. But
Yeah.
I'm much lazier than her.
I love it. I love weight training.
And you do weight training?
Yeah.
And
I do weight training. I play paddle. I walk my dog.
you look
I'm
fantastic. So that's
thank you.
really
I'm
good.
always on the move.
Yeah.
So I have to be because it keeps me. And yesterday I was so anxious. I don't even know why. The weightlifting wasn't cutting it. So I literally got onto the treadmill. I hate running. I got on the treadmill and I ran for 5 minutes, just really fast. And I got off and I feel a lot better now. Yeah, I really needed something. I need to get it out of my body. So I just think the connection between exercise and anxiety and mental health is it's a magic wand for me anyway.
Yeah. I always say if you can bottle exercise in a pill, you would make a fortune. Because exercise,
Yes.
if you look at, say, exercise, you would just to stick with my area, which is musculoskeletal joints. You know that exercise improves knee osteoarthritis pain. It improves, but and people argue, well, it's okay. It doesn't have a fantastic effect, but it has a mild effect. Yes, but what else does it have? It's not just its effect on knee osteoarthritis. It also has a positive effect on mental health, on blood pressure, on your muscles, on
Your sleep.
So it's like it's like waving a magic wand and just going, whoop,
Yeah.
you've done a session today of exercise, and this is now, it's like magic dust over your body. So it has lots and lots of positive effects. And I think if you could bottle that, that'd be great. And people are trying to do that, but I don't think it's possible. So I think it's the biggest, it's the magic pill that we have that I don't think people take advantage of.
Yeah, I agree.
Mm-hmm.
And before you go, what advice you could give midlife women? One piece of advice in your specialty, what would it be?
So in my specialty, I mean, I think it would be keeping active. That would be my advice. Doing something that keeps you active. We were talking about exercise, and I think doing something you really like doing and doing it consistently, and I think that is probably the best advice that you could get.
Nice.
I think.
Thank you.
Perfect.
That's
Thank
great.
you. Thank you so much for coming today.
Thank you for having
time.
me. Fun.
Thank you for being here.
Yeah.
Yeah, it was great. It was great. Reiterated everything that we already know and do. And yeah, so thank you.